Based on the data in front of us, it is clear that reopening widely, such as under the red category of the provincial framework, is not advisable at this time.
Canadians are getting increasingly frustrated with their public health officials, particularly in Toronto and Peel region, and more of them are starting to push back, to ask critical questions and to say, hang on a second, is this really the better way? We've learned that Toronto and Peel are most likely going to be staying in lockdown. I know they say they're moving you to a better category, but that's not true.
Dr. Davila will be laying out her view for moving Toronto into the gray zone next week.
Gray region is still technically called lockdown by provincial government frameworks. So there you have John Tory endorsing Dr. Eileen Davila, who wants to keep Toronto locked down.
That while there are evident reasons for a change in status, there remain reasons or risks that underscore how moving back into gray status is and will be a delicate balance.
In Peel region, Mayors Bonnie Crombie and Mississauga, Patrick Brown and Brampton, kudos to them, they said they wanted Peel to move into the red zone, meaning a lot more freedoms are allowed in terms of barbershops, salons opening up, gyms, and so forth. But Dr. Lawrence Lowe there, he said, it's not going to work. Got to stay in gray zone. And Davila has confirmed that the two of them, they've been talking on the phone, and I guess they agree. They're working together to keep their regions in lockdown.
I feel quite confident, speaking for both Dr. Lowe and myself, that we're watching the data carefully and that what we see in our discussions and what we have put forward is a cautious approach.
Why didn't they get on the phone with York Region Chief Medical Officer Dr. Karim Kurji, who has a much more evolved approach to dealing with the situation? He says, no more lockdowns. We know retail outlets, places like that, are not causing spread. It comes from indoor close contact gatherings. So even if there is a spike in cases that follows this drastic decline that we are currently seeing, he says we're going to take more focused, more targeted approaches. Sure seems like a much more mature perspective to have there that Dr. Kurji is embracing. Why can't we see that in Toronto? Why can't we see that in Peel region? Perhaps because not enough people are demanding it yet. Not enough people are making noise. I wrote some features the other day about how Peel Health was rather bizarrely saying that kids, they need to be put into isolation for 14 days alone in a room by themselves if someone in their class at school later tests positive for the virus. Alone for 14 days? Bizarre. Peel region, they retracted that. They apologized. They said it was wrong. Well, there you go. They admitted that they are fallible. They are not perfect. Well, you know what? Maybe the Peel region recommendation to stay in gray lockdown is also a bit fallible, and maybe you have the right to speak up and push back. I know we're told, listen to the experts, do exactly as they say, but does that mean take what they say hook, line, and sinker and not ask any critical questions? No follow-ups? Not at all. Do not forget, public health officials are still senior public servants. They answer to the politicians who answer to you.